Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. A person reaching young adulthood around the year 2000 is known as, well, a millennial. Those are our kids. Some of us, those are our grandkids. And just like any other time in history, they need to be taking care of their health in general. But for young women especially, need to be particularly focused on taking care of their reproductive system. Our guest in studio today is Bayer spokesperson and women's health nurse practitioner, Barb Dehn. She's returning to talk with us about some of the concerns that millennials should have, and if they don't have these concerns, how they can get information and become concerned about better reproductive health. How are you doing today, Barb?
Neal, it's great to talk with you again. Thanks for having me on.
Thanks so much for returning. Talking about millennials, just like anyone else's kids and grandkids, it's our responsibility to kind of let them know that there are things that they need to take care of as they move into young adulthood, finances, health. It's easy to say, hey, take care of this, take care of that, but it's often a bit harder to give some guidance. What types of questions should you ask, and what are the answers that you should be looking for when those questions are asked when it comes to reproductive health?
Well, I always recommend that as a parent or caregiver or grandparent that we ask, don't tell. And we try to find where that young person is in their own development or what their biggest concerns are. Because everybody is at a different place. Some people are wondering, how do you go out and have fun in college and still stay safe? Mm-hmm. Some are concerned about not getting pregnant. And some are just concerned about, how to deal with roommates, a new job, et cetera. So I always like to ask first and spend a lot of time listening before I start giving advice.
Okay, so basically find out where they are, not only in their reproductive health and making those decisions, but find out where they're coming from as a young adult in general.
Exactly. And how do they make decisions? The other day I was talking to my niece, and she had never been for a reproductive health visit ever. And she's in her mid-20s. She just never had access. She never had health insurance. She said, well, what do I do? What do I ask when I go in to see someone? I don't even know where to start. And so I gave her 3 tips, and maybe I can pass them on.
Great.
So I said, number 1, you should ask, well, how often should I be coming in to see you? Number 2, what kind of screening tests do I need? Because, those pap smear guidelines, they change every 5 minutes, and also, do I need to be tested for sexually transmitted infections? Which ones? How often? And then the third question is, what kinds of things should I be thinking about when I think or consider what kind of birth control methods to use?
Okay, so when they're considering what types of birth control they should use, how often does abstinence come into the picture?
Well, abstinence does come into the picture for a very large group of people, and they've made that choice with their partners. And sometimes with abstinence, we talk about, well, what is abstinence? Because some couples are having intimate contact with one another without having intercourse.
Absolutely.
And yet they're still at risk for some sexually transmitted infections and for pregnancy, which many people are very surprised about. So we do talk about, well, what's your definition of abstinence?
Excellent.
So that we can clarify myths and help people make good choices, have fun, and stay safe.
Excellent answer, because, we often look at abstinence as this blanket issue. It's a catch-all for sexually transmitted diseases, emotional distress, and we don't delve into, as you say, abstinence from what specifically? Yeah,
Neal, I do, because I'm often surprised at how people define abstinence, and also it helps us take and really listen. I always say this to my students at Stanford. We have 2 ears and 1 mouth, so we can listen to our patients twice as much as we talk. So we really want to find out where that person is, what they are doing, and how to help them make the best choices for their own health.
What about deciding when to conceive? What types of questions should they be considering when it comes to, how many kids do we want to have? Where do we want to live? What about schools? How do we want to, educate our child? Above and beyond just the sexual reproductive health, what about the things that come after conception?
I'm so glad you asked that. I think so many times, we all focus on, a symbol. Like, I'll give you an example. Many times people focus on the wedding, but not the marriage that lasts a long time, or they focus on the 24 to maybe 48 hours of giving birth, but not the parenting. And so I think that so often we kind of forget the forest for the trees. And one of the things I talk to my patients about is talk to me a little bit about what you envision for your future. Do you envision children in your future? When do you envision that? And what's the family size that you're thinking about? And what kind of lifestyle would you like to lead? Are you thinking about working full-time? Are you thinking about working part-time? Would your partner be involved or not involved? Do you have a partner? What have you guys talked about together if you're in a partnership about parenting? Because so often people make a lot of assumptions about their partner, what they want, and then all of a sudden they're pregnant, and then, I wasn't really thinking about that. They find out maybe later on. So I think it's really good to help foster open communication between partners, and that's one of the things that we do, is help women start to think about it and maybe give them some ideas for how to bring up these very personal topics with their partners.
We're here talking about women's reproductive health. Now, we all know about malpractice, and we've heard horror stories about, the wrong foot being amputated, that sort of thing. But the particularly disturbing stories that we hear are those concerning people dealing with women's reproductive health. What types of questions should she ask a potential practitioner, and what should she look for in those answers that an OBGYN is giving her?
Such a great question. I think that the most important thing is trust, and I think a lot of that comes from your own gut and your own instincts. If you're with a healthcare provider and you're talking to them, you're picking up on a lot of signals from the office environment and from how this person talks to you. Do they look you in the eye? Do you get a good feeling about them? Do you think you can trust them when you ask questions? And also, throw out a question, any question. It really doesn't matter. See how they answer it. Are they respectful of you and where you're at? Do they want to be a partner in your care with you? Are they talking to you at your same level? And I think all of those things go to, is this someone you feel comfortable with when you come to them with questions that, I see myself and a lot of providers now, we see ourselves as partners in care, as people who provide education, who dispel myths, and who help people make the best choices for them. Because, again, everybody comes from a different place, and we want to be listening so we can say, well, based on what you're telling me, this option might be better or that option might be better.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, and we've been in studio today talking with Barb Dehn, Bayer spokesperson and women's health nurse practitioner, award-winning author, and nationally recognized health expert. Now, she holds a BS from Boston College, earned her master's degree at University of California, San Francisco, and she's an in-demand and very popular national speaker, as I said, on all aspects of women health, not just reproductive health. She also lectures at Stanford and is a very frequent health expert on television, appearing on CBS, ABC, CNN, and many, many others. And it's been great having her here with us today on Health Professional Radio. Thank you so much, Barb.
It's a pleasure to be here. Thanks so much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.